I'll now introduce the next speaker, Patricia Enriquez. Patricia is a scientist in the formulation development team of the Inhalation and Advanced Drug Delivery Group at Hovione Research and Development. Patricia holds a master's degree in pharmaceutical science and a PhD in pharmacology both from the University of Coimbra. Her works resulted in several peer-reviewed publications, and she was recently awarded the Peter R. Byron Graduate Student Award. So, Patricia, the floor is yours.
Thank you so much for the introduction. So, good afternoon, everyone. My name is Patricia. I'm a scientist, as probably most of you here. And as a scientist, wouldn't it be great to have fortune tellers in our lab to predict our experiments, right, people? So I really wanted one, but probably I would get there and she would tell me, oh, tomorrow will not rain, which is amazing, you know, by the way, in Edinburgh, it would be amazing, but not very useful. So basically I had to make the decision to make my own predictions, and that's what I'm presenting here today, which is about predicting the performance of nasal powder formulations, entitled In Vitro in Vivo Correlations of Amorphous Solid Dispersions for Nasal Delivery. As an introduction, what are amorphous solid dispersions? So basically this is a powder formulation strategy that employs a polymers to stabilize the amorphous form of a drug, improving its solubility. And for nasal delivery, this seems to be especially promising because we can have this polymer with a second function, namely to improve the mucoadhesion. Additionally, we can manufacture these amorphous solid dispersions by spray drying, obtaining tight control over particle size. However, in spite of the current knowledge on formulation development and characterization, there are still very scarce studies analyzing the potential of amorphous solid dispersions. Are they really promising? Additionally, one of the main challenges of nasal powder development is to accurately predict the performance of these formulations because there's a gap between in vitro and in vivo, and also some lack of regulatory guidance. So what can we do on this? A useful tool that could really help us would be to have predictive in vitro methodologies, you know, to screen our formulations and guide our development. So we could use here a very nice tool, which is in vitro in vivo correlations. Accordingly, the goal of this study was to establish in vitro in vivo correlations between in vitro drug release and ex vivo permeation using Franz diffusion cells and in vivo PK profile, assessing two things. The first, the predictive potential of these in vitro methodologies, and the second thing, understand if amorphous solid dispersions are really good or not for the nasal delivery of poorly soluble drugs. What did we do? Briefly, we manufactured a total of 3 powder formulations, 2 by spray drying and 1 physical blend. We used a model poorly soluble drug, piroxicam, at a 20% drug load, and 2 polymers, either PVPVA or HPMC for the spray drying, and 1 physical blend with HPMC. We characterized them by particle size, morphology, also solid state by X-ray powder diffraction, and we performed our in vitro studies. So we did in vitro drug release and ex vivo permeation using Franz diffusion cells. They tried to mimic physiological conditions because they have the temperature, the medium, that slow hydration in the donor compartment, in a humid environment. And the drug release basically employed dialysis membranes, while the ex vivo permeation, we used excised porcine nasal mucosa that was taken from ventral nasal turbinates. For both of them, we used 5 milligrams of powder, we placed them into the donor, and then we collected samples on the receptor, which had simulated nasal fluid, for 6 hours. We also performed in vivo PK studies. These were carried out in Wistar rats after the intranasal administration of 1.5 milligrams of powder. We had the lateral tail vein cannulated to collect the blood in several time points, up to 30 hours. And then the PK profiles were plotted. We submitted non-compartmental analysis. And we got these outputs here. Let me get the pointer. So some of these outputs, so the maximum concentration on plasma, the time to get it, so the Tmax, and also area under the curve. And we correlated some of these outputs with in vitro parameters, namely the in vitro release and ex vivo permeation at either 20 minutes or 1 hour. Let's see some results now, the most exciting part. So we obtained these 3 formulations, very beautiful: spray-dried microparticles and a physical blend. They have really different particle sizes and morphologies, but our DV50 was within our target of 10 to 45 micron, and we got amorphous solid dispersions by spray drying, so the 2 of them were amorphous. Regarding drug release, we can see that both amorphous solid dispersions, which are the green and the orange lines, improved the dissolution of our model drug. This is also true for permeation, but at early time points. These differences in the profiles are probably due to the different membranes we used. Obviously, the porcinasal mucosa, it's a much more complex and a thicker membrane, so the transport is also slower. We can also see that the HPMC amorphous solid dispersion, the green one, it showed enhanced drug release and permeation compared to the PV-PVA. And this is possibly due to the supersaturation phenomena that happens in the donor compartment. So the HPMC may sustain this supersaturated state for a longer period of time, enabling a higher transport. After nasal powder administration to Wistar rats, piroxicam was quickly absorbed. And here we can see that the Cmax of the spray-dried microparticles of HPMC was the highest, also the shortest Tmax, followed by the spray-dried microparticles of PV-PVA, and finally the blend. So this suggests also here 2 things. That first, the amorphous solid dispersions for nasal delivery of poorly soluble drugs seem to be an advantageous strategy to provide a faster onset of action compared to the crystalline drug. And then the second thing is that the polymer seems to have a critical role here. As we see, the HPMC showed a higher profile, and this should be critical to achieve the most efficient delivery. So we got these 3 parameters. We got them from the PK profiles. We got these 4 in vitro parameters showed here, in vitro and ex vivo, 20 minutes and 1 hour. To note that we chose early time points because we had really fast drug absorption. And here are our correlations. And, well, there's a lot of information, but we have 3 graphs. Each graph is 1 PK parameter. So we have Tmax, then Cmax, and then area under the curve for the first 1 hour. The correlation coefficient showed here is the best one for each graph, so the best in vitro for the in vivo. Let's look into the first graph. So the Tmax, for the Tmax, we see that in general, the in vitro release results had better correlation than the ex vivo. However, we have here an inherent limitation. Since we had limited blood collections at early time points, and we used the non-compartmental analysis, so there was not a lot of differentiation between the formulations. Regarding Cmax and AUC 1 hour, the highest correlation for Cmax was ex vivo permeation at 20 minutes, and for AUC 1 hour, the in vitro release at 20 minutes. In general, we see that there were stronger correlations at the 20 minutes time point, so the shortest one. This suggests something very interesting, which is that the very fast supersaturation phenomena, which is captured in these in vitro and ex vivo methods, that happens very quickly, has some correlation to the in vivo, so it really seems to affect the absorption. In general, we can see that our in vitro and ex vivo methods with Franz diffusion cells showed good correlations with all these parameters, and this indicates that our methods may be biorelevant and provide valuable insights into drug absorption. Furthermore, if we had to choose one, so the in vitro or the ex vivo, possibly the in vitro release here would probably give us enough information, but if we would have permeability modifiers, probably the ex vivo permeation would be better. But to implement in an industry, for example, the in vitro method is much more simple. In conclusion, so we had 2 goals here. The first one, to assess the predictive potential of some in vitro methodologies commonly used. The second one, to understand if amorphous solid dispersions are promising or not. So firstly, amorphous solid dispersions for nasal delivery seem to be a suitable strategy to provide a fast onset of action for poorly soluble drugs. This can be very useful for example, therapeutic indications that really need this fast onset of action, like pain management. And then regarding IV-IVC, our PK parameters revealed good correlations, and this shows that these methods may provide some insights on our formulations and enable us to do formulation screening. So I think we are one step closer to become fortune tellers. However, we still have a lot of future work to do. One of them is obviously the development of integrated particle deposition and dissolution testing. That would provide us better predictability and phenomenon understanding of the whole thing that is happening with nasal powder development and administration. That's it. Thank you so much for your attention.
Thank you, Patricia, for your nice presentation. We can now take a couple of questions from the audience.
Yeah, here.
Okay.
Hi. Snežana, GST Antivirals. I don't know if you see me.
I don't know.
Coming down.
Where are you?
Coming down.
Oh, sorry. Hello.
Very, very nice presentation. Thank you. Maybe because you were talking about the impact of polymers on your preparations of ISD. I don't know if you thought about that, and maybe it's far ahead of your development. But do you expect because usually polymers are tricky in terms of regulatory, have you thought about how choice of polymer will impact then afterwards your CMC and development and approval from the regulatory perspective?
Just to understand if I got your question right, you're talking about polymers and the regulatory aspect, right?
Yes, yes.
Okay.
Because you said which polymer you select is extremely important.
Yeah, that's a very nice question, and thank you. We know that HPMC, this specific one, is one of the FDA, in the FDA inactive ingredient database for nasal powders. So that gives us already some confidence that it's probably okay to use it. We've also performed some cytotoxicity tests with these polymers, and they should be fine. So I'm not very concerned on that, on these specific two polymers. Of course, if we are thinking of really new excipients, there should be a lot of studies to prove that it's okay to administer nasally. But these polymers in specific, they've been used for so many other routes as well. We don't believe that should be a problem.
Perfect. Thanks.
Thank you.
Thank you. Are there any? Oh, right there.
Okay, I'm over here too. Very nice presentation, Jane Hasted from JDP Pharma. Did you do any other characterization for your physical chemistry to look at X-ray, for instance, in DSC, to show that you actually have did you have a full dispersion? Because without the dissolution data, you did the permeation, basically the combination through the transwell. I'm just wondering what the solid state form was of the drug.
Mm-hmm. Yeah, we performed a whole bunch of physical-chemical characterization, stability. We did a lot of things, and we definitely characterized by DSC and X-ray powder diffraction. They were amorphous solid dispersions, okay? So they were amorphous and one TG. But something very curious was that the PV-PVA would stabilize better through time. So it was really stable a long time. It's always amorphous. While the HPMC, which was the best here, was not so good in stability. So I guess I did not have a perfect formulation in the end. I probably, I should do some more screening or other polymers, for example, or different combinations of polymers. I could try, PV-PVA and HPMC, one to stabilize the amorphous and another to improve solubility. But that's something very important to test, okay? Not only if it's good at time zero, if it's amorphous, but also to see through time if it's still amorphous.
Yeah, and then also I'm looking forward to seeing your dissolution data, because when you have the supersaturation, you get the boost when you have the amorphous drug, right? You get a rapid dissolution rate, but then it'll crash down.
Yep, yeah. That happened. And we did that dissolution, and for both of them there was a crash. And I think what is interesting here is that for the nasal mucosa, we have such a small quantity of mucus and of liquid that it will crash somehow, right? It's not like in our stomach. So yeah, they both crashed, but the HPMC lasted for longer. So that was here the difference that we were able to see.
do we have another question from the audience?
If I could just ask a question. It follows on a little bit from what we were hearing this morning about the difficulty of administering powders to small animals.
Yeah.
What was your administration method, and how did you have to problem solve with that administration?
I had so many issues, my God. First, the rats don't like to have their tail veil cannulated, so they try to take it off. So many of the animals that I used were not shown here as results because they took cut off the tail, the thing. But regarding the administration, we tried to, the rats were not anesthetized while we administrated. We just had to really immobilize them physically with our hands really well to make sure that they were not moving. And then we administrated with a device with a proper tip. I cannot disclose the device, but we were able to quantify the amount of powder by weighing before and after, and basically by immobilizing very well the animal. What happened sometimes was that if it moved somehow, the powder would come out of the nostril, and we could see it, and these powders were yellow, so very easy to see. And those animals were not used for the results. Yeah, I had N equals 3, but in reality we had a bunch more animals, and it is what it is, right? You need to optimize your method and your handling until you get everything right.
Thank you.
Okay, thank you, Patricia, then.
Thank you.
Thanks.